start the intercostal arteries and intercostal veins, that is nothing but the intercostal vessels. So first we'll start with intercostal arteries. So for that we need to see this diagram. So actually the intercostal arteries are total 11 in number on each side. So of course we have 12 spaces, 12 intercostal spaces, but they are 11 in number, the space between the upper lip and lower lip. So like that we have total 11 spaces in number on each side, and the 1 and 2 are called posterior intercostal arteries, which arise from the superior intercostal artery. So what is this? We'll see here. So you can see this is a descending, this is ascending aorta, and this is a descending aorta, and this is the arch of aorta. So mainly in the arch of aorta, it is divided into brachiocephalic trunk, and also it is divided into this brachiocephalic trunk, is in turn divided into right subclavian artery and right common carotid artery, right? So left side it is divided into left common carotid artery and left subclavian artery. So our main part which we are going to have concern today is left subclavian artery. So especially the left subclavian artery second part is giving rise to our costocervical trunk. This is called as costocervical trunk, and this costocervical trunk especially it is divided into superior intercostal artery and also dorsal common artery. So mainly the superior intercostal artery is going to dorsal cervical artery, that is, I think. So mainly this superior intercostal artery is the one which is giving the branches to the first two spaces, and coming from the third space onwards our posterior intercostal artery comes into the charge. So mainly the posterior intercostal artery arises from superior intercostal artery. That superior intercostal artery is in turn a branch of costocervical trunk, and this costocervical trunk is of course coming from the left subclavian artery second part. So mainly from the 3 to 11 spaces all arteries arise from the descending thoracic aorta, and the right side of the arteries, you can see the right side of the arteries are more longer when compared with the left side, because the thoracic aorta is mainly is situated on the left side when compared with the right side. So because of this you can see it's the right side should travel a longer distance to come to the anterior side. So mainly the right side arteries are longer when compared with the left side arteries, and also in front of the vertebra, right posterior intercostal artery is longer than the left ear and pass behind the esophagus, thoracic duct, azygous vein and sympathetic chain. So that one we'll see in another diagram. So here you can see mainly this artery is passing behind. So esophagus, behind thoracic duct, behind azygous vein, and also behind the descending thoracic aorta, hemizygous vein, sympathetic trunk. So behind all this structure, actually this one is situated over here in sides of this thoracic aorta, everything. So you can see this artery is traveling behind all of those structures. So what are those structures? Let me repeat them again. Esophagus will be somewhere here, and you have the thoracic duct will be here, and next you have the azygous vein and sympathetic chain. So all behind them the posterior intercostal arteries travel, and this left posterior intercostal artery is mainly passing behind the hemizygous vein and also sympathetic chain. So remember, only on the left side you have the hemizygous vein. So the posterior intercostal artery travels behind the hemizygous vein and also sympathetic chain. And in intercostal space, the artery is accompanied by the vein. Of course we know, because the order we know, vein, that is vein first, artery first, and next the nerve. We already discussed about the nerve, now we are discussing about artery, next we will also discuss about vein. So they move especially in the costal groove of the rib, in the inferior border of the posterior groove, in the posterior surface of the rib, and first they travel between the pleura, and next in the internal intercostal membrane, and later they travel between the intercostalis intima and also internal intercostal muscle. So this posterior intercostal artery end at the level of costochondral joint, here the costochondral junction, by anastomosis with the upper anterior intercostal artery of the space. So you can see this is the upper. For example, this posterior intercostal artery is coming from rib number 5, you think, for example. So if this posterior intercostal artery is coming from the rib number 5, but it anastomoses with the upper anterior intercostal artery. Upper means with 4. So this anterior intercostal artery is from 4th rib, but this posterior intercostal artery is coming from 5th rib. So it anastomoses with the 4th anterior intercostal artery, that you need to remember. So actually this is a internal thoracic artery. So from the internal thoracic artery, this anterior intercostal arteries come. In the anterior side, this is the sternum. So especially at the junction of costochondral junction, the where the costal cartilage articulates with the rib. So at that junction especially you can find this anastomosis of posterior intercostal artery with the anterior intercostal artery. And the branches, it gives different branches like dorsal branch, which mainly supply the muscles of the skin and back, and also give the spinal branch to the spinal cord vertebrae, the dorsal branches. You can see this is the dorsal branch. And next you have the collateral branch, which is forming near the angle. So this is the angle, here it forms a collateral. You can see this is the lateral cutaneous, this is a collateral branch. So this collateral branch is also formed at the angle, and this collateral branch descend upper border of lower rib and end by anastomosing the lower anterior intercostal artery of the space. So it anastomoses with the lower one. So for example, this is, as we already said, this is from fifth rib, then it will articulate with the lower one with fourth one. So like that. And the muscular artery supply the intercostal muscle. Of course, as the name, muscular artery supplies the intercostal muscle, especially it supplies the pectoralis muscle and also serratus anterior. And the lateral cutaneous branch, you can see the lateral cutaneous branch, it accompanies the nerve of same name, that is lateral cutaneous nerve. And next, the memory branch. Also some memory branches are coming. This is a memory branch. This memory branch is especially seen in female from 2 or 3 or 4th space artery, and also supply the memory gland. And right bronchial artery arises from right third posterior intercostal artery. The special thing, we find only in the third posterior intercostal arteries, it also gives rise to right bronchial artery. That we need to remember. So you can see here, the right bronchial artery is arising from the right third posterior intercostal artery. Discuss somewhat, we discussed lot points about posterior intercostal artery. Now we will discuss somewhat about the anterior intercostal artery. So actually it is in the present, especially in the 9th intercostal space, anteriorly it forms a 2 anterior intercostal artery in each space, and the upper 6 spaces arise from the internal thoracic artery, but in 7 to 9 spaces this anterior intercostal artery especially arises from the branch of musculophrenic artery. So remember, in the upper 6 spaces, so now this is up to only 6 spaces, because you can see here the anterior intercostal arteries are arising from the internal thoracic artery. But from the 9th space, this is not the internal thoracic artery, it will convert into musculophrenic branch, musculophrenic artery, which is giving rise to the anterior intercostal artery in the case of 7 to 9 spaces. And the upper intercostal artery, as we discussed, up to 6 spaces, those all anterior intercostal arteries end at the costochondral junction by anastomosing with the posterior intercostal artery, we know. And even the lower intercostal artery, which are nothing but coming from the musculophrenic branch, they also anastomose with the collateral branch, but they anastomose with the collateral branch of the posterior intercostal artery. This is very important point. So once again you can see here, the upper 6 spaces arise from internal thoracic artery, whereas the 7 to 9 spaces artery is a branch of musculophrenic artery. So the upper intercostal artery ended the costochondral junction by anastomosing with the posterior intercostal artery, but the lower intercostal artery anastomoses with the collateral branch of the posterior intercostal artery. So this is about our intercostal arteries. Now we will see about intercostal veins, but you may think like, why I am showing again the same diagram, because even the veins also are like the same thing they follow, but what is the only difference in them, we will check out. So intercostal veins are mainly having 2 anterior intercostal veins, same like this. So now just imagine it in a blue color. So now these are the 2 anterior intercostal veins. So these 2 anterior intercostal veins are present in all the 9 spaces of the intercostal spaces, and the upper 6 spaces, the veins end in the internal thoracic vein. The same like here, as we have internal thoracic artery, instead we will have the internal thoracic vein. Whereas coming to the 7th, 8th and 9th spaces, the veins end in the musculophrenic vein. So same here, even in the arteries, up to 6 space only we have the internal thoracic artery. Later from 7, 8, 9 spaces you will have the musculophrenic artery. So instead in the vein they will have the musculophrenic vein. And next, the one posterior intercostal vein along with the one collateral vein in each intercostal space forms a this veins, this all veins are the vertebral canal veins, the vertebral venous plexus veins, the muscle, skin of back, all these veins come and drain into the posterior intercostal vein and also into the collateral branch of the posterior intercostal vein, and they accompany the collateral branch of artery which drain in the posterior intercostal vein. Of course, this collateral corresponding artery also travels here, because we know the vein structures vein, artery, nerve. So above the vein passes, below the artery passes, and next to it nerve passes. Everything follow the same course, but only we are separating them and studying in somewhat detail. So this is about intercostal veins. And one more thing we have, important one, is about this. So that is on right side. So till now we are talking about the anterior intercostal veins, but the posterior intercostal veins are having somewhat different drainage system, like they drain into separate sides. On right side they have some other drainage system, on left side we have some other drainage system. We'll discuss about that now. So you can see that the termination of posterior intercostal veins. So on right side they mainly drain into the first one, the first posterior intercostal vein drain into right brachiocephalic vein. So you can see here, this is the right brachiocephalic vein, as I written in right side, this is left side. So right brachiocephalic vein is drained by the first posterior intercostal vein, and on left side, whereas on left side if you see this first posterior intercostal vein, it drain into, again of course, left brachiocephalic vein. Next, second and third, fourth, on the right side they drain into the joint to form a right superior intercostal vein which drains into azygous vein. So you can see here, that's why I have make them rounded 2, 3, 4. They three together, they form a right superior intercostal vein, and later they drain into the azygous vein. You can see this is the azygous vein. Whereas on left side, this 2, 3 and 4 join to form the left superior intercostal vein and drains into left brachiocephalic vein. This is very important. So you can see on the right side, 2, 3, 4 joining to form the right superior intercostal vein, and they are draining into azygous vein. But the left side, this 2, 3, 4 are joining together. Of course, they are forming the left superior intercostal vein, but it is draining into the left brachiocephalic vein. You can see here, left brachiocephalic vein, but not into the azygous vein. But on right side they are draining into the azygous vein, on left side they are draining into the, again, the same left brachiocephalic vein like the first one. So here you can also round up the first one according to the drainage we are rounding them. So 1, 2, 3, 4 all drain into the left brachiocephalic vein. And next, coming to 5th to 8th posterior intercostal veins drain into directly azygous vein here, but on the left side they drain into accessory hemizygous vein. So you can see here 5 to 8 all, I rounded them, they all are draining directly into the azygous vein, whereas here the 5 to 8 are draining into the accessory hemiazygous vein on the left side. And next, coming to 9 to 11 and also subcostal. Subcostal is, it's a 12th one. Even in the nerve, even in the vein, even in the artery, it's a special one. We will not mix it up with anyone because it's having a special name, subcostal. In the case of nerve, we will call it subcostal nerve. In the case of artery, we will call subcostal artery. In the case of vein, we will call subcostal vein. So it's a special one. So this 9, 10 and the subcostal vein here are draining on the right side to the azygous vein, same. But whereas on the left side, it's draining into the hemizygous vein. So we can see here the 9, 10, 11 and also 12, you can round it together, and also 12 they are draining into the azygous vein, but here 9, 10, 11 and also 12 drain into the hemiazygous vein on the left side. So this is the only difference you need to find out in the case of veins. And now we will also check out you can see here, we will also check out the lymph of the intercostal space. So the lymph is mainly coming from the anterior space and pass into the anterior intercostal space and also to the anterior mammary nodes, that is along the internal thoracic artery. So the lymph is draining into the internal thoracic artery. We already know that one. So here, if you remember right, this is intercostal artery. So the lymph comes, and next their efferents unite with the tracheobronchial and also brachiocephalic nodes, form the bronchomediastinal trunk. So remember, the efferents are coming from the internal thoracic artery. They unite with tracheobronchial and also brachiocephalic nodes to form the brachomediastinal trunk. and this which joins the subclavian trunk on the right side and also thoracic duct on the left side. So on right side it is joining the subclavian trunk, on the left side it will join the thoracic duct. This is all about the lymph drainage. So left side lymph is draining into thoracic trunk, right side to the subclavian trunk. So lymph from the posterior part of the space. So till now we have understood about anterior space. So anterior space lymph first will go into the anterior thoracic artery. From the anterior thoracic artery it will branch with the tracheobronchial brachiocephalic nodes and from the bronchomediastinal trunk, and that bronchomediastinal trunk in turn it joins the subclavian trunk on the right side. On the left side it will join the thoracic duct. Now we'll see from the posterior side the lymph where it is going. It is going to posterior intercostal nodes which lie near the heads or necks of the rib, and their efferents in the lower four space unite to form trunk which descend and open into cisterna chyli. This is important. So posterior part of the lymph is draining into the cisterna chyli, and the efferents from the upper spaces they drain into the thoracic duct on the left side, and of course right lymphatic duct on right side. So here only difference is the anterior one will drain left side same thoracic duct, even the posterior one left side thoracic duct, but the right side is differing in the anterior and posterior of lymph drainage. On anterior side the lymph drainage on the right side is subclavian trunk, whereas on the left side whereas here the right side on the posterior part is in the right lymphatic duct. So this is all about the intercostal vessels and also lymphatics. Next we will learn the internal thoracic artery.